Okay, so your first step with your patient is going to be to develop the care plan. We're going to start with this patient, Chung. When you press on the patient and you scroll down, you're going to first go to the Dr. Pinnell's recommendations from IV, and you're going to press over here to review what he had put. So I think it's the easiest if you take this and you copy and paste this information into what's going to be your care plan. So we use Google Docs for the care plan. You're going to be using it here, and I just like to put this information here. That way I have it available to me while I'm doing the care plan with the patient. The first thing you're going to do is you're going to call your patient and you're going to introduce yourself. You're going to say, "Hi, good morning. My name is Jessie. I'm calling from MedAssist. I'm looking to speak with, Mr. Smith. I'm going to be your patient's care manager or your care manager, depending on if it's an aide that you're speaking with or a family member. And I just had a few additional questions for you since I'm going to be your new care manager and you had your phone call appointment with our Dr. Piniella. Is this a good time for you to talk or do you have a better time?" Then you're going to go over, Dr. Piniella recommended that you can only walk with a walker and to possibly get you a wheelchair because you have a fall risk. He also recommended that we get physical therapy for you twice a week. And you kind of just go through this and then you're going to ask them the questions below. So we're going to go into a little bit of the care plan. Now the first initial time you call them should be about an hour, right? So you have a solid hour that you can spend with the patient and going over everything that they need and anything that they want to talk to you about. And so this is the first kind of stuff that you're going to want to go through with the patient. So you're going to ask them what their physical therapy information is. Do they see a physical therapist? Do they not see a physical therapist? And you're just going to write in here. So patient does not currently have PT, which means physical therapy, need to set it up for him. And then same thing with the rest. Do you have the PCP as a primary care physician? Do you have that? You're going to put, yes, PCP is Dr. Smith, his phone number. And then you're just going to put the number 201-937-7511. And you just kind of go down the list with them. Do you have a secondary insurance? It's very self-explanatory. You're pretty much just asking them the questions and writing the responses here on the side. So that's pretty much how you complete the care plan. Now, this might only take you about 15 to 20 minutes to go through with some of the patients who don't really need that much, but it should be stretched out as long as you can and really try to talk to the patients for as long as you can and really develop anything that they think of. A lot of times the patients don't know how much we can help them with. So if you mention to them, "Hey, do you have any hobbies? Have you considered joining a club for this?" That's not something that they even know that is available for us to help them with. So however long you spend in the original care plan, you have their remaining time to complete that first hour with the patient, and that's how you will be completing your care plan. In the next video, we're going to go over how to attach this to the patient's chart, but this is what I wanted to show you so far of how to complete the care plan.